we are going to be part, as we will talk in a little bit, of the way to help them keep that weight off. So very, very importantly, whenever we talk about bariatric surgery, we tell patients that bariatric surgery is a tool. It's not necessarily a magic wand, right? It is a tool, very, very powerful tool, but nevertheless a tool. So if they have tried to eat healthy and exercise and they failed time and time again to lose weight, and they've realized ultimately that bariatric surgery is the right answer for them, we're not telling them, okay, stop eating healthy, stop exercising, let's do bariatric surgery. What we tell them is, to the healthy eating, to the regular physical activity, we're going to add this powerful tool so that not only you will lose a lot of weight and you will become healthy, but you will be able to maintain that weight loss for the rest of life. So struggling with weight becomes history in their life. That is our goal, essentially. But it requires commitment. It requires attention. It requires constant focus. And this is really the topic we're going to talk about today, essentially. So the basic foundations remain the same. In other words, you know, we are what we eat, right? We have to be absolutely careful about what we eat. So eating cannot be a mindless, casual, unplanned activity any longer. It has to be focused, it has to be planned, and they have to be knowledgeable of what they're eating. Many of the sessions that our nutritionists hold with our patients in preparation for bariatric surgery is really to equip them with this foundational knowledge. And we want them to keep that knowledge and practice that knowledge for the rest of their lives as well. Now, this does not mean that there are not going to be times in which they lose focus, in which perhaps they will be indulging in things that they are not part of their regular diet. We're talking about habitual eating. We're not talking about the occasional weekend, the occasional vacation in which they will be doing other things. We're talking about habitually what it is that you do. A bariatric patient should know what they will be eating from 7 days a week, right? They should know. It should not be something unplanned, right? And then when they eat, they have to understand that eating foods that are substantive, that are nutritious, that are low in calorie, that fill them up quickly is very important for them, right? And then also the whole practice of eating, right? You have to eat and be mindful of your eating. You cannot afford yourself to really relinquish the activity of eating to a secondary activity when your mind is wandering on other things, whether it's watching TV, talking to other people. Yes, occasionally you may engage in that kind of behavior, but foundationally, as a matter of habit, when you're eating, you have to be focused. So there has to be what we call mindful eating. Right. So
how do we actually do that, Dr. So like it's not to put you on the spot, but it's kind of easy for us to say mindful eating. Well, I had my dinner last night and I thought I was mindful, but then after I ate, I didn't feel so mindful. So how do we do that?
Well, we have the tool now. We have the tool, and that's exactly what we're talking about, right? Let's take the most common procedure we do, right? The gastric sleeve or sleeve gastrectomy, right? From a stomach that naturally tended to just expand and accommodate however much food we push into it, now we've changed the stomach into a fairly stiff tube that can accommodate only a certain amount. And after that, the pressure inside that tube rises so that if we overfill it, discomfort starts to happen, right? That is a powerful tool. That is something that people who have not had bariatric surgery do not have, right? So what we tell them is be mindful to that sensation. Once you start feeling full, you don't want to be going to the extent in which you are uncomfortable or, God forbid, throwing up because you've eaten too much, right? You want to be in a situation where you start to understand that stomach is getting full. That requires practice, that requires focus, right? The difference between being full and uncomfortable for somebody who's had bariatric surgery could be one bite, one extra bite, right? For you and I mean, you correctly are bringing the example, for instance, the difference between feeling full and uncomfortable could be a whole new serving, right? You've had appetizer, you've had the first course, and now if you want the second course, you were full in the first course, and now you're adding this other course. Now you may be uncomfortable after you've eaten a whole other plate. For a bariatric patient, it's different. It's an additional bite that can cause that, right? So we want our patients to start being very much in tune with what's happening in their stomach, in that when they feel full, they would stop before they become uncomfortable. Now, there are different strategies to really practice that and make it work well for them, right? One of the strategies, for instance, Kamal, is to have a plate which has less food so that you don't get into a temptation of, eating more, right? So many of our patients, for instance, instead of having a very large plate, they use very small plates, right? In a small plate, there is only a certain amount of food that you can put, right? Once you're done, you're done. If you have a large plate, then and you're distracted and you're doing other things, the temptation to continue to eating will be there, right? But there is also a much more problematic issue with that, Kamal, and that is you can actually get used to getting that extra bite without discomfort. Sometimes patients ask me, how is it possible for somebody whose stomach has been reduced to about 15% of its original size to gain weight years afterwards? Well, I tell them it's not a question of you now being able to grow your stomach back to its original size. It's that now you're allowing for that stiff stomach to slowly become more and more compliant, able to accommodate more pressure, right? Which means that if at the beginning the patient was feeling full after they ate 5 bites, right? And then when they try to eat that bite number 6, they feel uncomfortable. If they, day in and day out, they push that bite number 6, they will reach a point where they are not uncomfortable anymore with that bite number 6. And then what will happen next time, come on? They may try bite number 7, right? And bite number 7 was uncomfortable at the beginning, but gradually that discomfort may go away as well if the stomach becomes adjusted to that additional bite, right? The problem here, Kamal, is that those extra 2 bites in each meal, they will be more calories in a day. And you need only about 50 to 100 calories extra every day for you to gain about 10 pounds in a year, Kamal. So if they were at their comfortable weight, they were 250, now they are 150. If that behavior starts to come out, they may be gaining 10 pounds now over 1 year, right? And if that behavior continues, it will be 20 pounds. And before they know it, now they will be back to the situation they were before, suddenly, right? And this is what we don't want patients to get into. That's why that mindful eating is important. But as we will talk in this conversation, Kamal, there are other components to this. For instance, regular follow-up, weighing yourself regularly, and physical activity are also extremely important tools.
For the regular follow-ups, we, at the time of the surgery, we already schedule our patients follow-ups up to 5 years. This is with the surgical group. It can be with the nutritionists as well, but we also want people to follow up with their primary care. Your annual wellness visit is something that you shouldn't be missed. And also those surgical follow-ups, post-surgical follow-ups are extremely important. But the trouble that I see, Dr. I'm sure you'll agree with this, the patient that I was talking about earlier lost 180 pounds. I was just checking that earlier. When I lose 180 pounds in 1 year, then why do I want to go back to the follow-ups? So
absolutely. I mean, and that's exactly, it's, human nature essentially is such that once you feel in a comfortable position, you feel that comfort is going to last forever, right? It's very difficult to see beyond that. But it's our job to educate them that the danger of weight regain will be there constantly because the biology that drove their weight to that level to begin with, the genetic makeup that they have inherited from their parents, that really was a main driver in their weight gain in the first place, that biology hasn't changed.
Mhm.
It is the process in which the metabolic activity happens that has been changed by the surgery. But the actual biology that drives that type of energy conservation hasn't changed. So in the right setup, in the right situation, it is possible for the weight to come back with any bariatric surgery, right? I used to tell you that there was a bariatric surgeon, 20 years ago in meetings, he used to tell us, you can out eat any bariatric surgery, meaning that if you really try very hard, you can regain weight with any bariatric procedure because the foundational biology that drove the weight to that level is still there. That hasn't gone away. That is why it is very important for patients to know that bariatric surgery is the beginning of our relationship with them. It's not the end of it, right? So we want them to continue to come to us. Now, granted, very often what we will see, Kamal, is that we will see patients actually coming to see us at their best. When they've reached really their weight loss, they want to show us how successful they have been. They want to show us how grateful they are to bariatric surgery, and we love them. But far more important, we want to be there when they are struggling, right? And it is when patients are struggling that they tend to be shy of coming, right? Because they don't want to show that they are failing. But we want to make them understand that we're there to support them. So we don't want them to wait until they've regained substantial amount of weight before they come after us. We want them to come early, right? To
Before
tell
it becomes a
us,
crisis.
because before it becomes a crisis. Now, when is it that it becomes the crisis? Typically, in my 20-something years in which I've been doing bariatric surgery, Kamal, what I have observed is that even people who lose weight and keep their weight off for a decade, for 12 years, 15 years, at some point they may start gaining weight. And this typically is associated with a life event. It could be divorce. It could be losing your loved one. It could be losing a job, some crisis that really stresses them so much that they lose focus. Not only they lose focus, but eating becomes a refuge for them again. And that's dangerous, right? That is the time when we want them to come back to us, where we can show them that help is at hand, whether it's through counseling or whether through encouragement. And that kind of help can help them avert that crisis-related weight gain that often, if left really unattended, can lead to significant weight gain, and then it's very difficult to lose weight again. Our body becomes even more resistant if we are gaining weight after we've lost it once before.
So now the other really important thing is like having a food log, right? So we want people to write down what they eat, record what you eat. So if you remember me sharing the diet that I'm following and the changes that I had to make, and I'm going to share that just so that because I want people to see, it's hard. It's hard even if you try. So so let me see, Dr. Gal, let me know if you're able to see what I'm sharing.
I can.
So what I'm showing here is this is my food log.
Mhm.
Okay, so my activities, my journal. I did 27 out of the 30 days in April.
Yep. Very good.
So there are days that I did fasting. It's averaging here. The ones that I didn't do, but for those, the one that I did, averaging about 16.4 hours.
Excellent.
What you see here is, you remember one of the issues that I was able to reconcile in February. I'm actually putting when I have any type of dessert, like milkshake is one of the weaknesses that I have probably. But Dr. Do you see any ice cream here?
I do not.
Okay, because I didn't.
Good. That's great.
So this helps me a lot.
Yes, yes, yes,
Um,
yes, absolutely. I can see that. I can
and
see that because we very often, willingly or not, tend to forget things that we may
Mhm.
have eaten and then we wonder, right? But tracking it in this way actually is extremely important because it helps us really look into where we are, and then it helps us prevent situations where we may be falling, right?
Because the reason, again, like you and I, we didn't have bariatric surgery. What we are trying to say is that we go through the same thing. Um, we are not saying that you have bariatric surgery now, your life is going to be hell. No, that's not the case. Hopefully, people understand that. So, what we are saying is that everyone at certain point in their life, they have to start paying attention to these, and we do. Now, the thing that I learned from you, Dr. Now, the thing that I learned from reading and listening others, I knew that I had to be honest with myself and I need to do certain things. And COVID really messed up our regular routine. So then, I had to go back to where I was, and I still need to. So, like, this jacket is from last year, and I want to be able to get into this without having any discomfort.
Mhm, mhm.
And those are kind of like our ways of measuring where we are. So what we see with our patients when I look at the perspective, so my usually my view is I'm looking at those patients in our case conferences when they come back second time, or when they drop out of the program. So that actually makes me think of the perspective a little bit more. And again, this is just from my side. So why do I think about these situations? So patient actually comes back second time, and immediately my first reaction is looking at their first consult BMI and their weight. And unfortunately, every time, almost no exception, 10 to 15% higher BMI from the last time they were with us. So this is kind of like the patient perspective, thinking that did they actually know this was going to happen? Because we have the same reaction when patient comes back, when they finish almost everything, and they're like, "Oops, I changed my mind." And then I'm not going to go through. And then again, immediately I'm like, well, she'll be back in 12 months and she'll be 15% heavier than she is right now. So can I stop this? That's my kind of like perspective on these issues. Dr. Guy, I think your connection is okay now?
Yeah, that is great. No, absolutely. I mean, and that second guessing is part of that apprehension that comes with bariatric surgery, but it's not just apprehension. Sometimes it's also a sense of guilt that is related to that stigma of obesity that we talked about many times in our session, which means that patients look at themselves as a failure if they opt for bariatric surgery, as if it was in their hands to change their situation. But we know that that's not the case. It's a biologically driven disease, which in the right environment becomes intractable. So that an individual at an individual level has less than 1% chance of getting rid of obesity by themselves once obesity gets to those levels, right? So, I can give you an example of a patient I saw today in my office about 8 to 9 months after bariatric surgery. That patient lost 175 pounds already, Kamal. And that patient now is going back and forth with his doctor because they're playing catch up with reducing medications. Every time they reduce the blood pressure medication, it needs to be reduced even more. So that person is not taking any blood pressure medications. The diabetes medications have been cut in a quarter of what they used to be. And that patient was using a CPAP machine every night for the last 20 years. Now they're not using the CPAP machine. They sleep so much better without it. Now, that patient is an attorney, come on, right? So somebody with high level of function and also education. Now, by the way, that person has offered very much to come in shows like this and share their experience because they want to make sure that patients also have that perspective. But the point that that patient made to me is that they felt sorry. They haven't done this 10 years ago, right? It doesn't think about it 10 years ago, but they were not ready. There was this back and forth second guessing, and that meant struggling for obesity for 10 more years instead of addressing it at an earlier stage. So patients' perspective is like that. But once the surgery is done, once they get through the surgery and they see the results, they feel, immensely happy. It's just a rebirth of sorts for them, really, because they're able to recapture this new life. And that is the case for the vast majority of patients.
Let's talk about the challenges a little bit. And then again, from the patient perspective and from the surgeon perspective, what are some the most biggest challenges you have ever encountered with the patients after the bariatric surgery?
Yeah, absolutely. So I think bariatric surgery is clearly a life-changing process, right? Because daily life of a person who's had bariatric surgery is going to be different from their life before, right? This is obviously physically they are changing, right? They're losing weight. The way in which they have to eat is going to be different, right? There are certain foods that may be agreeable to them or not. They cannot go to foods just as something that they will go to because they are stressed, right? Because their ability to eat a certain amount of food is going to be limited, right? Relationship that they have with their loved ones, with their friends, with their community is also going to be different, right? So there are a number of challenges that require absolute preparation before bariatric surgery. And that is why we have this extensive preparation, because we want our patients to be prepared not only on how they have to eat, not only in understanding things like what is a protein, where do we find the highest level of protein, what is carbohydrate, what is fat, okay, and how much protein should I have, what are vitamins, what kind of vitamins should I have. Not only that, but we also have to prepare them at the fact that they will look at the mirror and they will be different, right? Drastically different within a short period of time. But also, they will be different also for their loved ones, right? And that may create its own dynamics as well. All those things have to be taken into account. Of course, one extremely important part of all this process also, Kamal, is to really work with our patients to really make sure they understand the indications for bariatric surgery in their setting, right? We're doing bariatric surgery because we are finding that their weight is too high, because they have developed diabetes, because they have high blood pressure. And we have to be able to really talk to them about alternatives as well. And that's what we do when we talk about the informed consent process, is to say, right, what are my alternatives to bariatric surgery? What are the risks and benefits of bariatric surgery in my individual setting, right? That's the question the patient wants to know. And that's where we have to come in and explain that. And they have to be absolutely comfortable, right? I saw a patient today, Kamal, that was a little bit on the fence about whether to do bariatric surgery or not. And she is in the process, right? But then she wants to take more time to think about it. She wants to try other options as well, right? And like I said to her, this surgery is an option. It's the best option right now, but it's not something I can prescribe to the patient and say, you must do XYZ because I'm your doctor and order so. Because of the important changes that occur in an individual, a bariatric surgeon has to work with the patient, and they both have to come to a consensus that that's the right thing to do. And for them to come to a consensus, the patient has to be comfortable. Now, granted, the vast majority of patients will have reached that point of understanding and acceptance when they come and see us, right? Because when the vast majority of patients, Kamal, as you know, will have thought about bariatric surgery for a long period of time before making that call or going to our website to make an appointment. In fact, on average, I think patients will have thought about bariatric surgery for 2 full years before they come to a conclusion that they need bariatric surgery. And those 2 years are going back and forth, right? Talking to friends, doing research, coming to Bariatric Friday and listening to the two of us, talking about these issues, all that will help them mature the idea that bariatric surgery is not only important for them, but it may be the best and only option for them. One of the best recollections I have, Kamal, is with a patient of ours. The patient was, in his mid-40s, very high BMI, and they came to see us. And at that time, that patient could not really be active physically. And because of that, that patient was on disability. So they were on a Medicare disability and they couldn't work, right? One of the greatest news for me was when that patient a year later came to us and asked us to certify that they were no longer disabled, that they needed to go back to work. And one of the stories that patient told me was that the previous few months were the best in his life because for the first time, he was able to take his kids to Disney World and get on the rides with his kids because he's never been able to do that before, right? So those are great individual stories. Yeah, very simple, right?
It's so simple that you don't even think about, and then
Absolutely.
this can
Absolutely.
become a huge challenge for people.
Yeah, absolutely. So that patient, we're no longer talking about the fact that that person is no longer taking blood pressure medication, diabetes medication. We're talking about their daily life as well. I can go to work now and be a normal working person and earn for my family, and I can take my kids and have enjoyment with them without having to feel guilty of not being able to go on a ride with them. So those are things that really make bariatric surgery worthwhile. And I think, as a physician, I feel extremely privileged to be in this field, Kamal, because it's extremely rewarding when day in and day out you hear stories like that from patients.
So I mentioned to you last week those couple patients who recently they posted on the Facebook support group, and they have their before and after pictures. And sometimes, my team here, they help me with getting prep for these events. So I feel like when I'm actually talking about it, in some cases, they may not really follow or they may not believe everything that I'm saying. So, okay, here's the picture. And this is the same person. Actually, we actually reviewed them last Friday together after the event. So it's the transformation from before and after this. It's just like unbelievable. So I think it's so great that we are able to see that type of outcome, which comes with its own pros and cons, I guess, because they may have some other cosmetic issues, but we know that from the well-being standpoint, being healthier and being able to function, being able to do certain simple tasks in life, it's a life changer. And I can tell you, from my side, which I was mentioning, where it breaks my heart when I see someone who finished the process, and this is. Most people are going to say, well, of course, you are going to benefit financially. Well, we are going to do something financially. We are going to have that benefit from somewhere. Doesn't matter. But this is having a huge impact on someone else's life.